Hello everyone, it's Dr. Fox, and let's talk about the kidneys. In this video, we'll identify the borders and poles of the kidneys. We'll also outline the structures found at the hilum of the kidneys and discuss the organization of the kidney parenchyma. The kidney structure is really quite simple. In fact, most textbooks refer to the kidney as a small kidney bean-shaped organ. So, there is both a lateral convex border and a medial concave border. This is an anterior view of the kidney. It's best to mention now that lateral border is not perfectly lateral, but rather it is oriented posterolateral. And the medial border is oriented anteromedially. So the kidney doesn't sit flat against the posterior aspect of the abdominal wall, but rather it's slightly canted, as we'll see. At the hilum of the kidney, the hilum is the region of an organ where neurovasculature enters and exits, we have a variety of structures. Principally, there is a renal artery which makes its way toward the hilum, where it begins to ramify into segmental arteries. There is also a renal vein present at the hilum that picks up segmental veins, although this is not present in this image. We can also see some of the structures of the excretory pathway. So I'm highlighting some of the major calyces that are coming together to form the renal pelvis. And the renal pelvis then drains into the ureter, which conducts urine to the urinary bladder. But also present in this region would be the renal plexus associated with the renal artery, as well as some lymphatics. Kidneys also have superior and inferior poles. And if there are any accessory renal arteries that supply those poles, we refer to those as polar arteries. Accessory renal arteries are quite common, so you may find these in the course of interacting with anatomical donors. So here we have a closer view of the hilum of the kidney, and we can see a very prominent renal vein. So this is a left renal vein. So it's receiving branches from the gonadal vein and a shared branch from the suprarenal vein and left inferior phrenic veins from the diaphragm. We could also see the relationship of the suprarenal gland, aka the adrenal gland, with the kidney. So you can see why we call it the suprarenal gland anatomically. Tucked away behind or posterior to the vein is the renal artery. Accessory renal arteries are very common in this area, as I've seen. And we can also see just the distal part of the renal pelvis as it makes its way into the ureter. The parenchyma is the metabolically active region of an organ, and the kidney parenchyma can be divided into two constituents. There is the outermost cortex, which surrounds the medulla. The cortex can be described in two regions. There are the portions that nestle between adjacent medulla. We call these renal columns. And then there's a portion of the cortex that's between the medulla and the outer capsule of the kidney, and we call that the renal column. Now, the medulla is organized into discrete regions that we call pyramids. And it's a pretty poor name for these structures because they're actually conical in shape. But in section, pyramids can be seen, so they're more pyramidal. The base of the pyramid is what is in contact with the cortical arch, whereas the sides of the pyramid are what are in contact with the renal columns. The apex of the pyramid is called the renal papilla, so plural, renal papillae. Renal papillae are surrounded by the most proximal parts of the excretory pathway called minor calyces. Minor calyces are going to condense into major calyces into the renal pelvis. Why I bring this up, why this is significant, is that the renal papillae are the last point where collecting ducts are going to drain into the minor calyces. So these represent the point of no return physiologically, where we have a clear border between filtrate proximally and urine distally to these renal papillae. So let's assess the knowledge. What structure found in the hilum of the kidney conveys urine to the ureter? Is it the cortical arch? Nope. Is it the medulla? Nope. Is it the pyramid? Nope. Is it the renal pelvis? Yes. Renal column? No. So D, renal pelvis, is the correct answer. Thank you so much for your time, and I look forward to speaking with you in the next video.